People may attribute edema in their legs to many diseases, but having edema in the legs is not always a risky situation. Why do our legs swell? Let's talk about that a little bit. The reason for swelling of the legs is edema. If your legs are completely normal when you wake up in the morning, but they begin to swell gradually during the day, and you can see this with the naked eye, and if you see that the lines on your ankle are gradually disappearing, this means that you have edema in your ankle. But usually this is not a sign of disease. And the most common cause of ankle edema is standing for long periods of time. Edema in the legs may occur in a sedentary individual who sits all day and stands all day. Approximately 40% of individuals, especially those over the age of 30, experience ankle edema at the end of the day. This condition is especially common in women. It is abnormal for a waiter or a teacher not to have edema in the ankle in the evening after standing all day. Yes, I am speaking so clearly, because constantly standing or constantly sitting is not a physiological action for us. It is an expected situation that the veins in the legs will expand after a while, and the fluid in the vein will come out of the vein, and this will appear as edema. So, what are the diseases that cause edema in the ankle? There are three important disease groups here. The first is heart failure. In an individual with heart failure, edema on the right side of the heart, edema in the legs and abdomen may occur over time due to heart failure. We call edema in the abdomen as acid. Edema may occur in the ankle, and when pressure is placed on that shin bone in the foot, a depression may occur there. The edema in heart failure is a soft edema, and we can see a scar left by pressing our finger. Another important disease that causes edema in the ankle is kidney diseases. Since protein leakage may occur in kidney diseases, when proteins leave the body, the density in the vein decreases and the fluid in the vein begins to come out. So kidney failure can cause ankle edema. Another cause of ankle edema is venous insufficiency. Venous insufficiency may also cause edema in the ankle. Liver disorders may also cause edema in the ankle as they reduce protein production in the body. In summary, I want to say this. The cause of edema in the ankle is usually our lifestyle. It's what we eat and drink. And it is when we stand or sit for a long time. It is usually not a sign of disease. However, if the edema in the ankle is persistent and reaches serious levels, then we can say that it would be beneficial to have your heart, kidney, liver, or heart and leg vessels examined. Ankle edema is usually benign and responds well to treatment. Goodbye.